Hello, and welcome to our presentation on the efficacy of using cognitive behavioral therapy in treating post-traumatic stress disorder in veterans by Gabrielle Bertrand, Jennifer Brown, Zachary Marks, and Hannah Misiuk. The subject of our study, Elijah, age 36, is a veteran who was recently diagnosed with post-traumatic stress disorder following a 12-month deployment to Iraq, which included active duty combat. Elijah started to experience nightmares, reliving the event, avoiding situations that would trigger him, becoming easily startled, had loss of favorite activities when he had returned home. Thus came to seek treatment. Elijah received 16 sessions with 12 weeks of treatment using cognitive behavioral therapy, or CBT. An ABA design was used for the CBT intervention. The subject's PTSD symptoms were measured at pre, during, and post-intervention after treatment using the Clinician-Administered PTSD Scale, or CAPS-5. The severity of Elijah's symptoms of PTSD were significantly reduced from baseline with CBT treatment. The study adds to the evidence supporting that CBT is an effective treatment for PTSD in veterans. Approximately 30% of veterans returned from war with symptoms of PTSD. Transition back from war can be very difficult, making it important that we discover the most effective treatment in alleviating their symptoms and increasing their quality of life. CBT has been proven to be an effective treatment across many studies in treating the symptoms of post-traumatic stress disorder in returning veterans. CBT is an evidence-based practice approach for treating veterans suffering from symptoms of PTSD. The purpose of using CBT is to alleviate and significantly decrease Elijah's symptoms of PTSD developed during his time serving in the war. Symptoms of war related to PTSD include difficulty with sleep, hypervigilance, flashbacks, anxiety, and depression. The goal of the study is to reduce Elijah's symptoms as measured using the CAPS-5 to reduce from his baseline after receiving 16 sessions over a 12-week period of CBT treatment. The researchers of the study are licensed social workers employed by the Department of Veteran Affairs and are qualified to conduct this study. We believe that this intervention will be effective because CBT has been proven to be an effective treatment in many different studies and locations for veterans experiencing symptoms of PTSD. This study will be using SMART goals, which are specific, measurable, attainable, results-oriented, and time-sensitive. Specific: use of CBT to significantly reduce symptoms of PTSD in Elijah will be measured by the CAPS-5. Measurable: data in this study will be measured on a scale from 0 to 4. Attainable: it is possible to measure Elijah's symptoms using the CAPS-5 assessment tool to determine the effectiveness of CBT in reducing symptoms of PTSD. Results-oriented: the team will use an ABA design, meaning Elijah's baseline can be easily compared to his CAPS-5 measurement during treatment. Time-sensitive: Elijah's baseline data will be collected over the first 4 weeks before the beginning of his treatment. Data will then be collected at weeks 6, 8, 12, and 16 of treatment, as well as follow-ups at weeks 3 and 6 months post-treatment. Elijah is a 36-year-old male currently living with his wife. The severity of his symptoms have been putting a strain on their relationship. Elijah has no history of treatment for mental health issues and has previously never been exposed to any traumatic experiences before serving in the military. There is a family history of men serving in the military and returning with symptoms of PTSD, but there have never been any formal diagnosis. Elijah has his wife as a natural support, but feels that he cannot talk to her due to his wife's growing fear and frustration. He is also finding support through the Department of Veteran Affairs. Elijah has been diagnosed with PTSD by a clinical psychologist who referred him to the Department of Veteran Affairs study for treatment. He was diagnosed using the CAPS-5. Elijah experienced combat, violence, and experienced life-threatening situations while serving the military over the span of a year. Elijah's symptoms of PTSD include flashbacks, difficulty sleeping, nightmares, hypervigilance, paranoia, disassociation, and suicidal ideation. Elijah has been self-medicating with alcohol in order to decrease severity of PTSD, feelings of guilt, and depression. Cognitive behavioral therapy is an evidence-based treatment for veterans struggling with PTSD. It is a type of psychotherapy that uses systematic techniques based on learning theory and cognitive psychology to help patients identify and correct dysfunctional thoughts, behaviors, and emotions. The goal during cognitive behavior therapy is to target current problems and symptoms, and focus on changing patterns of behavior, thoughts, and feelings that lead to difficulties in functioning. Cognitive behavior therapy is an evidence-based treatment modality for PTSD most consistently recommended by Best Practice Treatment Guidelines, Trues et al. 2011. A study was conducted on veterans with PTSD who suffered from insomnia. 22 veterans were enrolled in a CBT. Findings demonstrated that CBT that targets trauma-specific sleep disturbances leads to a large reduction in PTSD symptoms and insomnia severity. Ulmer et al. 2011. Using a randomized controlled pilot study design, data was collected through the clinician-administered PTSD scale for the DSM-5 from 30 patients admitted to the paraplegic center that suffered from PTSD due to their injuries. Trauma-focused CBT protocol was applied through 14 sessions. Data was analyzed by descriptive and multivariate statistics. Findings show that the level of PTSD symptoms gradually decreased from high at baseline to low during follow-up stage. Kahn et al. 2021.
There are multiple reasons to use for choosing cognitive behavioral therapy to help treat post-traumatic stress disorder. There's been a considerable amount of research that has established effectiveness both in short-term therapy and how it's highly engaging with subjects. Holds the patient accountable for the therapeutic outcome, and it is centered on the idea that one's emotions and thoughts are responsible for how they behave and feel. We hypothesized that 12 weeks of cognitive behavioral therapy, or CBT, which is an independent variable, lead to a reduction in the severity of PTSD symptoms, the dependent variable, in Elijah. CBT is a safe and effective treatment approach for both acute and chronic PTSD following a range of traumatic experiences in adults. PTSD is a mental health condition that individuals may develop after experiencing or witnessing a life-threatening or traumatic event. Elijah will be provided the clinician-administered PTSD scale for the DSM-5, or CAPS-5, at the baseline, week 6, week 12, and week 16 to measure his progress. Throughout the study, we will be using the clinician-administered PTSD scale, or CAPS-5. The CAPS-5 is a 30-item structured interview that can be used to question the subject about the onset and duration of PTSD symptoms, the impact of those symptoms on social and occupational functioning, and improvements in symptoms. For each symptom, standardized questions and probes are provided. Administration requires identification of an index traumatic event to serve as a basis for symptomatic inquiry. It is recommended that the Life Events Checklist for the DSM-5, in addition to the Criteria A inquiry of the CAPS-5, is used. For diagnosis of PTSD, at least one symptom in each of the 6 sections after the first must be met. The CAPS-5 uses a rating scale going from 0 to 4. 0 represents absent. The respondent denied there was a problem or the respondent's report didn't fit the DSM symptoms criterion. 1 is mild or subthreshold. The respondent described a problem
that's consistent with the symptomatic criterion, but isn't severe enough to be considered clinically significant. 2. Moderate or meets threshold. The respondent described a clinically significant problem with a minimum frequency of 2 times a month. 3. Severe or highly elevated. The respondent described a problem that was above threshold. The problem is difficult to manage and at times overwhelming, with a minimum frequency of 2 times a week. 4. Extremely or incapacitating. The respondent described a dramatic symptom far above the threshold. The problem is pervasive, unmanageable, and overwhelming. The team used an ABA single subject design to evaluate the application of cognitive behavioral therapy for treating post-traumatic stress disorder. During the first stage, Elijah will attend weekly hour-long sessions over the 16-week period, where he will complete the CCAPS-5 with a clinician during the first 4 sessions to get a baseline of current PTSD symptoms. The intervention will start during the 5th week of the study, with Elijah continuing to have hour-long sessions with a clinician trained in trauma-focused cognitive behavioral therapy, which will continue until week 16. Elijah will complete the follow-up CCAP assessment on the 6th week, 12th week, and 16th week, after which the researcher will withdraw the intervention to establish a new baseline. After the completion of the study, there will be a follow-up with the subject at 3 months for final administration of CCAPs to see how he is progressing.
After gathering data, the team created a graph and visual displays of the relevant details and outcomes. This will include the baseline, intervention, post-intervention baseline, and follow-up. The graph will identify Elijah's changes and progress before, during, at the end of the intervention, and follow-up after intervention ended. The graph will also visually display Elijah's symptoms, the PTSD decrease with cognitive behavioral therapy interventions, and remain lower at his follow-up appointment, proving that CBT is efficient when treating his PTSD.
Elijah participated in 16 sessions of weekly treatment for post-traumatic stress disorder using cognitive behavioral therapy. The treatment started during the 5th week. An ABA single subject design was used, with A signifying the baseline or clinical intake, B signifies the treatment phase, and the second A signifies the second baseline after withdrawal of treatment. Post-intervention and follow-up will be taken 12 weeks after intervention ends. The following practice techniques of CBT were used during the treatment phase of 1-hour sessions per week: psychoeducation, journaling, unraveling cognitive distortions, cognitive restructuring, interoceptive exposure, nightmare exposure, and restricting. Progressive muscle relaxation, relaxed breathing and relaxation techniques, positive coping skills, not turning to substance use or self-harm, trauma narrative and cognitive processing of the traumatic events, identifying and correcting dysfunctional thoughts, behaviors, and emotions. At the baseline phase of the ABA design, a licensed clinician will complete the PTSD CAP-5 scale with Elijah. This occurs during the first 4 sessions in order to measure the severity of his PTSD symptoms. During the treatment phase, the intervention would start on the 5th week, where Elijah participated in once-a-week, hour-long sessions from weeks 5 to week 16, during which the previously mentioned CBT techniques were used to treat Elijah. During this phase, a clinician will also complete the CAP5 assessment during the 6th week and on the 12th week. During the withdrawal treatment, at the end of treatment in week 16, treatment was completed and withdrawn from Elijah. At this time, he would complete a final CAP5 scale to see how he was scored. After 12 weeks, there would be a follow-up with Elijah to see how he's continuing to do with maintaining his progress. Here we have a graph showing the efficacy of cognitive behavioral therapy for Elijah. For the y-axis, we have the CAPS-5 scale. For the x-axis, we have the number of weeks of service. If you look at the first 4 weeks, we can see that the baseline Elijah established, scoring 115 during week 1, 114 during week 2, 113 during week 3, and 114 during week 4. After the intervention, starting at week 5, we can see the reduction of PTSD symptoms that Elijah was reporting through the CAPS-5, where he scored himself at an 84 during week 6, an 80 during week 8, and 78 during week 12. As we continue the interventions, Elijah continued to report reductions in his symptoms. At the end of the treatment, Elijah reported a score of 52. During the follow-up visit 12 weeks later, he reported a similar score of 53. This shows that over time, he had a decrease in his PTSD symptoms and was continuing to manage them. Using the CAPS-5, a 30-item questionnaire which rates each question on a scale from 0 to 4. A rating of severe generates a score between 90 and 120, a mild to moderate score is between 60 and 89, and a mild to no symptom score is between 0 and 59. During his baseline evaluations, Elijah reported an average score of 114, or severe. During the treatment phase, Elijah reported an average score of 81, which is mild to moderate. When taking the final CAPS-5 questionnaire at the end of the treatment, Elijah reported a score of 52 or mild. After the 12-week follow-up, Elijah continued to report a score of mild at 53. In conclusion, cognitive behavioral therapy appeared to help Elijah reduce his symptoms of post-traumatic stress disorder during his 12 weeks of treatment.
Ethical challenges and resolutions. Withdrawing treatment after 16 weeks has the potential to create an ethical challenge. This was addressed by testing after completion of intervention and connecting Elijah with a long-term individual therapist. If Elijah's symptoms had worsened, treatment could be restarted immediately if needed. Exposure to trauma can also lead to an increase in symptoms. Elijah was tested at regular intervals and was given skills to deal with his trauma he endured from his 12 months of deployment in Iraq. Elijah did not experience an increase in severity of PTSD symptoms post-intervention at his 12-week follow-up. A benefit of using the ABA design is that the team should be able to see the intervention they're using is having a positive effect on the subject when the intervention is withdrawn. This can help control if there are any outside variables that were not accounted for impacting the effectiveness of the treatment. One limitation of using the ABA design is when withdrawing the intervention when the behavior modification is considered desirable, then it would seem better to end the investigation on a treatment phase rather than on a baseline phase. Internal validity refers to the confidence we have that the result of a study accurately depicts whether one variable is or is not the cause of another. The PTSD scale for the DSM-5 CAPS is well established as a valid and reliable instrument for assessing PTSD diagnosis and severity for veterans. Maturation and statistical regression are threats to internal validity in this study. The effects of these variables were controlled for by limiting the duration of time which the experiment was conducted. Our study supports the growing research that cognitive behavioral therapy is an effective treatment tool at treating post-traumatic stress disorder in war veterans. This was a single-subject ABA design study. The study tested Elijah using the CAPS-5 assessment tool to measure the severity of his PTSD symptoms pre, during, and post-experiment. Elijah showed a decrease in severity of PTSD symptoms during the intervention. Elijah's new baseline measurement scored lower than those during the treatment and showed an improvement in baseline measurement prior to the treatment. The intervention had a positive impact on Elijah. The severity of his symptoms decreased significantly, and his baseline has improved since his initial measurement. Our team continues to recommend cognitive behavioral therapy as a treatment for soldiers who are suffering from post-traumatic stress disorder. In harmony with the team's principles and ethics and desires of our client, Elijah, CBT is an effective evidence-based treatment. CBT is a type of psychotherapy that uses systematic techniques based on learning theory and cognitive psychology to help patients identify and correct dysfunctional thoughts, behaviors, and emotions.